HPSP is the state of Minnesota's monitoring program that provides a voluntary way for licensed healthcare workers to fulfill professional reporting obligations related to illness. HPSP helps healthcare professionals get the care they need for an illness or medical condition that could make them unsafe to practice. Statistics show that health practitioners struggle with addiction, mental health issues, and medical illness at the same rates as the general population. In 1994, the state legislature authorized the health licensing boards to establish a monitoring program called the Health Professional Services Program. This new law provided a way for practitioners to get help without board involvement if they agreed to be monitored during their recovery from a potentially impairing illness. Thus, HPSP is referred to as a confidential monitoring program. HPSP monitors how health professionals manage their illness by collecting information about their progress in treatment and job performance. Additional requirements may include practice limitations and random urine testing. Confidential monitoring means that HPSP does not have to report to the licensing board when a person enrolls in our program. However, there are some exceptions which are reviewed with the practitioner at the time of enrollment so that he or she can decide whether to go forward. The functions of HPSP are to protect the health and safety of Minnesota citizens, to identify health professionals with illnesses that are potentially impairing in practice, to provide an incentive for healthcare professionals to get help before patient safety is compromised, to make sure health professionals get a comprehensive assessment and appropriate treatment for their substance disorder, mental health, or other medical condition, to monitor the practitioner's recovery and work performance for patient safety, to educate the health professions about impairing illnesses in the workplace. Health professionals are referred to the program in three ways: self-referred with no board involvement, if they comply with monitoring expectations; third-party report filed by an employer, patient, coworker, treatment provider, or anyone concerned about a health professional and public safety; referred by a licensing board under disciplinary action for an evaluation to see if monitoring is needed or as follow-up to an identified illness. Any health professional is eligible who is registered, licensed, or in the application process with the state of Minnesota and has an illness that is potentially impairing in their practice. The cost of HPSP is free to the participant because the licensing boards pay for our services. The licensee is responsible for the cost of the assessments, treatment, and if required, toxicology screens. Health professionals, like anyone else, are susceptible to substance, psychiatric, and other medical conditions. If left untreated, these illnesses can put the finest clinicians and their patients at risk. If you or someone you know needs help, call HPSP at 651-642-0487.